Welcome to Sticky Med, learning medicine, stick by stick.
Because we're going to talk about two concepts today, confounding and effect modification, and they both involve that third variable, but they are polar opposites.
Totally opposite. It's so important to get this right. One of them is a distortion. I mean, it's a bias we have to get rid of to see the truth.
Yeah.
We're calling that one the liar.
Okay, the lie.
And the other is a genuine biological reality. It's something vital that we need to understand and report. That one's the clarifier.
So our mission for this deep dive is pretty simple. We want to give you the tool, sort of a gold standard test, to tell the difference between the liar and the clarifier. Okay, so let's start with the one we want to get rid of, the liar.
The liar is confounding. And its role is, it's to distort the truth. It's behind so many of those bogus findings you see in studies that get retracted.
So it makes it look like A causes B when it doesn't at all.
Exactly. Or sometimes it even hides a real relationship that's there. The sources called it a mixing of effects, which I think is a perfect description.
A mixing of effects, I like that. So it's just noise. It's a statistical mistake, really.
It is. It's a bias. And because it's a bias, the researcher's job is always to eliminate it. You have to adjust for it, control for it. Whatever statistical tool you use, you're trying to peel it away to find the real story underneath.
The classic analogy for this, and it really sticks in your head, is the rooster. You know, you see a rooster crowing at 6 a.m., and a few moments later, the sun rises.
Right. If you didn't know any better, you'd think, wow, that rooster makes the sun come up.
The crowing causes the sunrise.
But the confounder here is just time. They both happen at 6 a.m. They're associated in time, but one has absolutely zero causal link to the other.
So if you control for time, if you go out and check if the rooster's crowing at noon makes the sun appear, you quickly realize the relationship was fake.
It was spurious. The rooster is just loud. That's it. And that's what confounders do. They create these spurious links.
Wait, so if confounding is all about spotting that bias and throwing it out, how does effect modification completely flip that on its head? Let's talk about the clarifier.
Right. Effect modification is not a bias. It's a fundamental truth. It's a deeper reality, showing that an exposure's effect is actually different depending on the group you're looking at.
So the third variable isn't noise. It's actually the key to the whole story.
It is the story, which means you do the exact opposite of what you do with confounding. You do not get rid of it. You highlight it. You report it. If you try to adjust it away, you're literally erasing the most important finding of your study.
That's why the other name for it is interaction, right? The two factors are interacting with each other.
Precisely. The analogy here is just as stark. Imagine a new drug. The clinical trial shows it works wonderfully for children. It's safe, it's effective.
Okay.
But for adults, the same dose is lethal.
Oh, wow.
In that case, age is the third variable. It's modifying the effect of the drug. If you just average the results for everyone, you might get a conclusion like, the drug is moderately dangerous.
Which is useless and incredibly dangerous. You wouldn't say, well, on average, people did okay. No, you'd put a giant warning label on it. For children only.
That's it. That difference is the finding. Confounding distorts the truth. Effect modification reveals a more complex, nuanced truth.
Okay, let's dig into an actual example of confounding. How does this bias actually work in the real world to lie to us?
So remember, the defining feature of confounding is that the relationship you first see isn't, real in a causal sense.
Right, like the rooster.
Let's take the classic example, alcohol and lung cancer. If you just look at a big data set, you might see that people who drink more alcohol tend to get more lung cancer. Superficially, it looks like alcohol is a risk factor.
But you have to ask, what else is true about people who tend to drink a lot?
Exactly. And the massive third variable, the confounder, is smoking. There's a very strong behavioral link. People who drink heavily are also much more likely to be smokers.
And we all know that smoking is the real culprit for lung cancer. So smoking is tied to both the exposure, the alcohol, and the outcome, the cancer.
That's the textbook definition. So what do? We have to adjust for it. The simplest way to think about this is a method called stratification.
Which just means splitting the data up.
That's all it is. We take our whole population and we split it into two piles, a non-smoker pile and a smoker pile.
Oh.
Now, inside the non-smoker pile, we look again. We compare the drinkers to the non-drinkers. And what do we find?
I'm guessing the link disappears.
Completely. Among non-smokers, there's no difference in lung cancer rates between those who drink and those who don't. Then we do the same thing in the smoker pile. Same result. The alcohol doesn't add any extra risk.
So once you isolate the groups, the lie is exposed. The relationship just vanishes.
It's gone. The conclusion becomes clear. alcohol doesn't cause lung cancer. Smoking was the confounder, making alcohol look guilty by association. We adjusted for the liar, and we found the truth.
That makes perfect sense for getting rid of a bias. So now, let's flip it. Let's talk about a case where that third variable doesn't make the risk disappear. It actually clarifies how incredibly dangerous it is.
This is where we get into real biology, and often a concept called synergism.
Synergism, meaning the total is greater than the sum of its parts.
Way greater. It's a multiplication of risk, not just an addition. And the most famous and frankly terrifying example of this is asbestos and smoking.
Two things we know are very bad for your lungs on their own.
Very bad. Asbestos exposure is a major cause of lung cancer. So is smoking. But when you put them together, that's where we see effect modification in action. Smoking becomes the clarifier.
So let's use that same test. We stratify. We split the data by smoking status. What do we see in the non-smokers?
Okay, so for a non-smoker who gets exposed to asbestos, say at their job, their lung cancer risk goes up a lot. The data suggests it's about a 5-fold increase compared to someone with no exposure.
5 times the risk. That's already really serious.
It is. But now look at the other group, the smokers who are also exposed to asbestos.
And this is where the synergism kicks in.
It's an explosion of risk. Instead of just adding the risks together, it multiplies. The studies show their risk can increase by up to 60 times the baseline.
60. From 5 times to 60 times, that jump is staggering.
It is. And you can see immediately why you would never want to adjust that away. Trying to average a 5x risk and a 60x risk would be criminally negligent.
Of course not. The message has to be, if you're a smoker and you work with asbestos, you are in a category of catastrophic danger that is completely different.
That's the whole point. Smoking modifies the effect of asbestos. It's a real interaction, and it has to be reported that way.
This brings us to the simple gold standard test. You've mentioned stratification for both. So how do we use the numbers to tell for sure if we're looking at the liar or the clarifier?
It all comes down to comparing 3 numbers. We use a metric called relative risk, or RR.
And just quickly, for everyone listening, relative risk is just a ratio, right? It tells you how much more likely one group is to have an outcome than another.
Yep. An RR of 1.0 means no difference. An RR of 4.0 means a 4 times higher risk. Simple as that.
Perfect. So what's the test?
It's core steps. Step 1, you calculate the crude relative risk. That's for everybody, all mixed together. Let's say we get a crude RR of 4.0. Looks like a big risk.
Step 2, we stratify. Split the data by our third variable. Let's use age this time, young versus old.
Step 3, you calculate a separate stratified RR for the young group and another one for the old group.
And step 4, the most important step, compare those numbers.
Exactly. Let's run scenario A, confounding, the liar.
We start with that crude RR of 4.0. Looks bad. We stratify by age.
And we find that for the young group, the RR is 1.0, and for the old group, the RR is also 1.0.
Okay, so you have 3 numbers. 4.0 crude, then 1.0 and 1.0 in the strata.
Now you compare. Here's the rule for confounding. The stratified RRs are similar to each other. They're both 1.0, but they're very different from the crude RR of 4.0.
The 4.0 was an illusion. It was a lie. Once we adjusted for age, the risk just vanished.
The bias is gone. So I'll say that again because it's the key.
Yep.
If the stratified risks are similar to each other but different from the crude, you're looking at confounding.
Got it. Okay, now let's do scenario B, effect modification, the clarifier.
Okay. We start with the same crude RR of 4.0. We stratify by age.
And this time?
This time we find the RR for the young group is 1.0, no risk at all. But for the old group, the RR is 8.0, a massive risk.
So our 3 numbers are 4.0 crude, then 1.0 and 8.0. The diagnosis is obvious.
It's crystal clear. The stratified RRS 1.0 and 8.0 are wildly different from each other.
Which means age isn't a bias, it's a biological reality. The exposure is safe for the young, but extremely dangerous for the old. You have to report those 2 numbers separately.
That's the whole test. Are the stratified results similar to each other, or are they different? That single question tells you if you're dealing with a lie to be removed or a truth to be told.
So just to summarize here, confounding is the bias you remove with adjustment. Effect modification is the biological fact you describe by reporting the separate risks.
Exactly.
So for you, listening to this, how does this help when you read a news headline about some study? You're probably not going to be running the numbers.
No, but you can look for the language.
Right.
When a study says they adjusted for or controlled for variables like age or income, they were hunting for confounders. They were trying to get rid of the liar.
And if it's effect modification,
Right.
the clarifier.
Then you'll see them report different results for different groups. That's called subgroup analysis. If you read, The drug had a small benefit overall, but in women over 50, the benefit was huge. That's effect modification. They found a specific truth for a specific group.
It really does move you from just, passively accepting a headline to actually questioning the result. Is this true for everyone, or is something else going on?
And that's the whole point. So here's a final thought. If knowledge is only really valuable when you can apply it, think about this. The next time you read a study and the results seem maybe a little too simple or a little too scary, ask yourself a question. Could this big, scary number be a massive lie caused by hidden confounder? Or is it actually a nuanced truth that only applies to a very specific high-risk group? The answer is almost always in how they report the data,